Hi, I'm Carol Bell, and I'm a registered nurse for Wayside Recovery Center, and today we'll be going over HIV, AIDS, and universal precautions and TB. Okay. First, we'll start with HIV and AIDS. HIV is a virus that affects certain white blood cells, T cells, that manage human immune system responses. When these blood cells are damaged, it becomes difficult for people to fight off infections or diseases. Someone with HIV receives an AIDS diagnosis when these T cells count is at a 200 or below, or there is a diagnosis of an opportunist infection. Now I'm going to talk about how it is transmitted. HIV is transmitted through 5 different body fluids. The first one is blood, then semen, vaginal fluid, rectal fluid, or breast milk. Transmission, again, understanding how HIV can or cannot be transmitted is at the core of preventing new infection. HIV is a rapidly changing virus, but thankfully it also is entirely preventable. HIV must be present, meaning that an infection may only occur if one of the people involved in an exposure situation is infected with HIV. Some people assume that certain behaviors or exposure situations can cause HIV disease, even if the virus is not present. This is not true. There needs to be enough virus. So the concentration of HIV virus determines whether the infection will occur. In blood, for example, the virus is very concentrated. A small amount of blood is enough to infect someone. The concentration of the virus in blood or other fluids can change in the same person over time. So persons who take HIV medications as they're prescribed, that virus can be lowered so it's not as concentrated as a person who is not taking the medications. So it's greatly reduced by medication. It is important to note that HIV is a very fragile virus, which will die quickly when exposed to light and air. Exposure to small amounts of dried blood or other infectious fluid is not a realistic risk for transmission of HIV. HIV must get into the bloodstream. That's another thing. So because it's a virus and it needs to be living, so it passes from a fluid, that means there has to be a way for you to get it into your system or the person that is engaging in a behavior. So it's not enough to be just like in contact with in the infected fluid of HIV to be transmitted. Healthy, intact skin does not allow HIV to get into the body. HIV can enter through an open cut or sore or through contact with mucous membranes. Transmission risk is very high when HIV comes in contact with the more porous mucous membranes of the genitals, the anus, and the rectum, which are insufficient barriers for HIV. Although very rare, transmission is also possible through oral sex because body fluids can enter the bloodstream through cuts in the mouth. Okay, now we're going to talk about a national perspective. The Center of Disease Control, that's the CDC, estimates 1.2 million people in the U.S. are living with HIV. Globally, it's like 36.9 million adults and children live with HIV. So 1 in 8 of those people are unaware of their infection. Young people are the most likely, meaning age 13 to 24, to be unaware they are infected. An estimated 44%, which is like 25,000 some, of those living with HIV don't know that they have it. In 2014, an estimate of over 44,000 people were diagnosed with HIV infection in the United States. The number of new HIV diagnoses fell 19% from 2005 to 2014 because HIV testing has remained stable or increased in recent years. This decrease in diagnosis suggests a true decline in new infections, and that's good news. Okay, so a national perspective, in 2014, an estimated 20-some thousand people were diagnosed with AIDS. And remember, the diagnosis of AIDS is with the actual number of the virus or different types of immunosuppressed diseases that you are diagnosed with. Since the epidemic began in the 1980s, an estimated 1 million, almost 1.3 million have been diagnosed with AIDS. In 2013, there was an estimated 13,000 deaths due to any cause of people diagnosed with HIV infection or as classified as having AIDS. And 7,000 deaths were attributed directly to HIV. Overall, a person has a 1 in 99% chance of being diagnosed with HIV in their lifetime. It is a higher diagnosis rate in the southern states. Okay, so that's the national perspective. The Minnesota perspective is a 1 in 2016 persons that could be diagnosed, and just to give you an idea, like in Washington, D.C., it's a 1 in 13. Now we're going to go over a little bit of the national perspective by subpopulations, and that's what the graph refers to. MSM represents 2% of the United States male population. MSM accounted for 83% of new HIV infections among males and 67% of all persons infected with HIV. Although there was a national decrease of 19% in the United States from 2010 to 2014, there has been a less than 1% increase in new infection among gay and bisexual males. The number of new HIV infections, 92%, was greatest among MSM in the youngest age group, ages 13 to 24. Young Black MSM most severely burdened as of 2014. So 1 in 6 gay and bisexual men will be diagnosed with HIV in their lifetime. 1 in 2 Black/African American gay and bisexual men, 1 in 4 Hispanic, Latino gay and bisexual, and 1 in 11 white gay and bisexual men. Okay, some more national perspectives by subpopulation. Once again, MSM continued. In a 2016 analysis, there is an estimate of 4.5 million gay and bisexual men living in the United States. 15% of them are HIV positive. 11% of them are unaware. So 1 in 7 gay and bisexual men are unaware. Heterosexuals accounted for 24% of estimated new HIV infection in 2014. And injection drug users represented 6% of the new HIV infection in 2014. Continuing with the subpopulation, and this is by gender, women account for 19% of people living with HIV, and this was at 2014. 11% of that 19% do not know they are infected. HIV infections among women are primarily attributed to heterosexual contact or injection drug use. Accounted for 19% of estimated new infections in 2014, 13% of this group were attributed to injected drug use. Men accounted for approximately 76% of those living with HIV in 2010. Transgender, in 2013, 28% of transgendered women account for those living with HIV and 12% self-reported. These discrepancies may indicate some women do not know their HIV status, although the prevalence in transgender men is relatively low, 0 to 3%. A 2001 study suggests that transgender men who have sex with men have a high risk of acquiring HIV. And then more about subpopulation. It's race. African Americans continue to experience the most severe burden of HIV. Blacks represent approximately 12% of the U.S. population, but account for an estimated 44% of the new infections in 2014. Latinos also disproportionately are affected by HIV. Latinos represent 17% of the U.S. population, but account for 24% of new infections in 2014. Okay, so this next slide, it gives you the rates of diagnosis of HIV infection among adults and adolescents by sex and race and ethnicity, and this was the 2014. And you can see there are other populations that I didn't speak about, and American Indian, Alaska Native, Asian, Native Hawaiian, and multiple race. Other points of interest. Linking people to care within 3 months after an HIV diagnosis improves their health and risk of transmission. In 2013, the majority of states with the lowest level of linkage to care were in the South. In some southern states, people living with HIV are 3 times as likely to die as those living in other states. The CDC is focusing efforts to fund state and local health departments to focus on prevention in communities, local areas where HIV is most heavily concentrated. Prevention. Pre-exposure prophylaxis is a way for people who do not have HIV but are at higher risk of getting it to prevent HIV by taking a daily pill. Okay, when taken consistently, it reduces the risk to 92%. Now we'll talk a little bit about the Minnesota perspective, and you can see that's our map there. Okay, so Minnesota HIV and AIDS surveillance. Since the epidemic in 1982, 11,000 persons have been diagnosed and reported with HIV infection in Minnesota. As of 2015, an estimated 8,215 persons are assumed alive and living with HIV/AIDS. 294 of these were newly diagnosed in 2015 in Minnesota. The number of cases involving injection drug users increased by 86%, and 58% of newly reported HIV cases are people of color. Now we're going to cover universal precautions. Okay, regular hand washing with soap, water, and paper towels help to reduce viral and bacterial transfer, especially colds and flu. Hands must be washed for a minimum of 20 seconds. Body fluids. Universal body substance precautions, handling of infection waste, will be followed by all handling of bodily fluids. This means gloves are provided and must be worn for all handling of bodily fluids or contaminated articles. Gloves and contaminated materials are disposed of in biohazardous waste baskets. Hands are washed after involvement. Disposable individual probe covers are used on thermometers. Sharp containers are available for disposal of needles and syringes. They are stored in med rooms. Needles or diabetic procedures or other uses are kept locked. No reusing of needles. Bleach solution 10% is used for cleaning restrooms and any body fluid spills. Personal hygiene. Clients may not share razors, toothbrushes, towels, combs, thermometers, or other personal hygiene supplies. Clients are responsible for sanitary napkins such as tampons and sanitary pads. They are to be wrapped in paper and placed in the wastebasket. Please direct clients to see a staff member if they should need assistance in purchasing personal hygiene supplies. Kitchen precautions. Okay, use of kitchen utensils or plastic gloves are required while handling food. Hands are washed thoroughly before working in the kitchen. Silverware or glasses are not shared. Dishes must be rinsed in hot water and run through the dishwasher before reused. Surface areas in kitchen and dining area are washed with sanitizing solution after each meal. Now we'll talk about tuberculosis. General information. What is TB? Tuberculosis is a disease caused by an airborne bacteria that is spread from person to person. TB attacks the lungs, however, can also damage any part of the body, including the brain, kidneys, or spine. Death can occur without proper treatment. Symptoms. General symptoms include feeling sick or weak, weight loss, fever, night sweats. Symptoms may also include coughing, chest pain, and coughing up blood. How is it spread? TB bacteria are put in the air when a person coughs, with who has TB sneezes or speaks. These germs can stay in the air for several hours. Individuals who breathe in the air containing these germs can become infected. This is called latent TB infection. TB is easily spread to family members or co-workers since it usually takes prolonged exposure to pass it. Okay, latent TB infection versus TB disease. Individuals with latent TB infection do not feel sick, do not have symptoms, and cannot spread the bacteria. They have TB bacteria in their bodies, but they do not have the disease. TB infection is detected by a tuberculin skin test, like what we do at Wayside, or a TB blood test. In some, the TB bacteria overcomes the immune system, which results in a progression from latent to TB disease, which is sometimes also called active TB. Without proper treatment, the bacteria multiply and destroy the body's tissues, including individuals with TB disease may spread bacteria to others. Those suspected of having TB disease should be referred for medical care. This concludes the HIV AIDS universal precautions and TB training that is required for Wayside employees. If you have any questions regarding this, you can contact me. My name's Carol Bell, and I'm the nurse at Wayside Recovery Center. Thanks.